Hello and welcome. My name is Dr. Carl Self and I am the Director of the Division of Dental Therapy at the University of Minnesota School of Dentistry.
And I'm Colleen Brickle, Dean of Health Sciences at Normandale Community College. Over the past year, we collaborated to create an employer guide to allow dental clinics to expand and include dental therapists and advanced dental therapists.
Dental therapy is still very new both here in Minnesota and within the United States. Understandably, there is confusion and misinformation regarding the role of this newest member of the oral health care team. We hope that this guide will provide factual information to potential employers about the role of dental therapists and how to incorporate them within any practice setting.
This guide can also be used as a resource for policymakers, dentists, educators, and anyone else interested in understanding dental therapy in Minnesota. As the concept of a mid-level in oral health continues to expand across the nation, we wanted a guide that would offer first-hand information in an easy-to-access format.
We would like to thank the Otto Bremer Foundation for their support of this project and for helping us to improve and expand access to oral health care.
Well, I think it's a future model. It's a way to increase access. We have such a gap in the economic abilities of families, and this is a way to bring service to everybody. And I think that's the principle that this is based on.
I've found it to be a very rewarding process in watching this whole position evolve, particularly as one of our dental therapists started out with us as I met her as a dental assisting student. She worked for us as an assistant and then a hygienist, and now she's a dental therapist. So I think that career ladder, having the ability to evolve upward, and it's been a great experience for her, but for me as well, to have that established relationship.
I agree. I've known Kelly a long time, and seeing her confidence grow has been very rewarding.
I guess my thought is this is a good thing. Mm-hmm. It's well on its way. Mm-hmm. I would encourage everybody to accept it and mm-hmm. And welcome it and make it part of their team, make it part mm-hmm. of their practice.
It allows us to do the more advanced work. She is accepted by everyone. She does beautiful work, and I would say you better snatch it up quick, because in a few years, you're not going to be able to get one.
If I was talking with a dentist that was really hesitant to hire a dental therapist, I guess I would ask them questions about their specific concerns. Mm-hmm. And you know, as I've said, concerns about safety, I think, have been addressed. Mm-hmm. Concerns about patient acceptance, I think, have been addressed. Concerns about whether or not they'll contribute positively to the economics of the practice. Mm-hmm. I think those have been addressed.
I would ask them to look at their community, where their practice is, and is everyone receiving access to care? And if they're not, and if their office has the capacity, if they have an extra operatory or they have a day a week that they're not in the office or whatever, then I would pose that as a question. Could you do more for your community if you had a dental therapist?
Absolutely.
Interestingly, when we at Children's Dental Services first approached the collaborative management agreement, we sort of thought, this is another piece of paperwork. This might not be that easy, but it has really turned out to be a blessing. I have to say, it has helped to carefully define the roles and responsibilities of the advanced dental therapist and the supervising dentist. And when they've had that sort of roadmap to work with together, it has really eased the working relationship, and they've been able to work again for 2,000 hours under that. And by the time they come to closure of that practice experience, they are ready to move on. They're ready to have that advanced dental therapist work independently and to understand clearly what the roles that each have in that process.
I like the collaborative management agreement that we have crafted because it carefully enumerates or lays out the scope of practice for our dental therapist, the protocol for when to call me if they have a question. I found that from a pediatric dentistry point of view, it was very easy to craft. Following along the guidelines from the Board of Dentistry, we didn't have any difficulty.
We did find it to be a benefit because it's so new, we needed that template. And we used the template to set things up. The Board of Dentistry was very helpful. It was simple, and it gives us a guidance, the guidance that we need with something that is so innovative.
Collaborative management agreement that the Board of Dentistry developed as an outline is very helpful. You can, I think almost anyone could go in and plug in what procedures and how the protocol should work.
We have the schedule set up for 2 days a week that she'll be going to the offsite. And everything is so new. We're having a lot of fun providing this care, and we're receiving a lot of support. And I think it's just going to work out fine. We'll have to do a lot of tweaking, but we're excited about the challenge.
I think one of the projects we're working on right now is working with a mental health campus located in Rochester. And patients with mental health issues have high dental needs as a group. And again, I think any place where there's a population that has high dental needs, has limited access to dental care, and in particularly where they congregate, so that you can deliver on-site care to them and they don't have to travel.
In the future, Children's Dental Services plans to work specifically with advanced dental therapy students and graduates to mentor them to go to areas of greater Minnesota that are currently underserved. We have no referral source for restorative care for public program patients across St. Cloud and the surrounding community.
Is off-site at Whittier Clinic, which is a medical clinic where the staff and providers were thrilled to get her there. She performs screening examinations, topical fluoride, patient education, and triages patients into our clinic, pregnant women and children.
And that works very well too, because she sees them at Whittier and then she sees them at HCMC at our main site. So she starts that relationship with them right away. They're comfortable coming down to the hospital because they know who they're going to see.